Okay, hi everybody. We're here for our first Capstone Chat of the semester. Today we're welcoming Julianna Hawthorn. She is in healthcare administration. She graduated here from Shepherd in 2010 with her Bachelor of Science in Comm and a minor in journalism. So please welcome her, and she's going to tell us how she got to where she is.
All right, thanks, Monica. Hi, everybody. So like Monica said, I graduated in 2010, and sometime around 2009, I was taking my capstone class and thinking about what was I going to do and what internship was I going to take. Back at that time, there was a professor, Dr. Lewin, and he did journalism and the school newspaper and all of that. So I was writing for the school newspaper, I was writing for the Martinsburg Journal, and I also worked for Pretty Man Broadcasting, cataloging music, which back then we didn't have digital music. We still had tapes and CDs. So I'm not going to talk anymore about that, but I wasn't really sure what my internship was going to look like. But I was in the Tri Sigma sorority, and I was also the Panhellenic president for the sororities at Shepherd. So I had a Panhellenic meeting at Buffalo Wild Wings in Martinsburg, and we were talking with a huge group of us about what activities were we going to do and what philanthropy were we going to do in the coming semester. And this man came up behind me in Buffalo Wild Wings, and this is like a theme for my life. So I want you all to know, like, just say yes to every opportunity, because this random man came up to me in Buffalo Wild Wings and he said, "Hey, sounds like you're in charge here." And I was like, "Oh yeah, I'm the sorority president." Like, you know, that's how I was back then. I would talk to anybody. Not much has changed. But he said that he was a nursing home administrator. He was new to the area. He was from South Carolina. His family was still in South Carolina. They hadn't moved yet. And he really needed a volunteer program at his nursing home, which was called Willow Tree Manor. It's in Charlestown, West Virginia. And he explained that it was under new ownership. It didn't have the best reputation. Not a lot of people came there, and they really were looking for people to come and spend their time with the residents that lived there, either for long-term care or short-term rehab. So he gave me his business card, and I set up an appointment with him the following Monday and went and met with him to talk about a volunteer program. I left that Monday meeting with a volunteer program for the sororities and the fraternities at Shepherd, but also with a paid internship. And he agreed to mentor me through my capstone project. And he said he had some ideas that he could make correlate to my program at Shepherd. So that being said, that turned into me coordinating a grand reopening of this nursing home. And I had to schedule a carnival themed grand opening. There were about 400 guests that needed to be invited. The mayor came for both Ranson and Charlestown. The newspaper came, the radio came, TV station came, all of the sororities and fraternities, they came. Plus all of the vendors and the families for the people who live there. And so my job was to do the entire event. I did the design of the invitations. I made the guest list. I wrote all the press releases. I made sure all the media relations requests went out. I redid their website at the time. So everything that I learned at Shepherd that I was actively learning at school went into that event. So that event went off well. And when it came time for my capstone, we did the presentations in an auditorium back then. And so everyone who worked at the nursing home came to kind of support my capstone presentation, as did my family. So it was kind of exciting because everybody that was there got to see that come full circle. And then, of course, I graduated. So when I graduated, they offered me a full-time job as their marketing director, which was not a position they had when I was working there. It's a position that they created for me. But I really loved the people there. I really loved the residents, and I felt like I had a really good mentor in the administrator that was running that nursing home. So not my plan. My plan was that I was gonna be a journalist, and I was going to go overseas, and I was going to report on the war. I was going to be a war correspondent. My mom was like having a heart attack, that I was dead set that I was traveling. And then I took a job at a nursing home in Charlestown, West Virginia, which was totally not the plan, but it was an offer that I couldn't turn down. And it was close to my family still. It was close to my friends. My family lived in Maryland, so it was only about an hour away. So I did that job for about 6 months, and I really loved it, and I feel like I learned a lot. And the regional for that company asked if I would like to take a bigger job. So they promoted me to a regional admissions position where I was responsible for 3 communities that they had in Baltimore, Maryland, plus the West Virginia facility. And that company started to grow. So that company eventually had about 23 communities in 5 different states. And so for about a year and a half, I did that regional role where I oversaw the marketing and admissions for all of those communities. And I told them, hey, I kind of want to get some of these specialty certifications that are specific to healthcare. So they said that was fine. And they sent me back to school to get my activity certification. And then they sent me back to school to get my assisted living license. And then they told me that I could get my certified dementia practitioner, because we have a lot of people with dementia that were living in our communities. And once you get the certified dementia practitioner, then there's another certification that you can get so that you can be a trainer. And then there's another one that you can get to be a manager. And then you can train people to be a manager, and you can kind of teach nationwide. If you love dementia care and love to teach, then you can kind of take that as long as you want. There's about 11 different levels of certification. So I'm 4 into the 11 at this point in my career, but you have to wait several years in between. You don't just get to take the class and then get it. You have to work with the population and actually utilize your certification for a couple years in between getting to the next level. So all of that being said, they sent me to all these different trainings and certifications, and then they bought more buildings, and then they offered me another promotion. So they made me the vice president of business development for their company. So then I oversaw all 20 of their properties that they had. So I got to travel, which was really fun, and I got to meet a lot of new people. And part of that role required me to do negotiations with insurance companies. So I would negotiate all of the insurance contracts that the different communities had in different states. I got to do a lot of grant writing with that, because there's a lot of federal funds that are allocated for nursing homes and assisted livings and their programming, that you have to be able to navigate the grant writing process, which some grants are like 500 pages that you have to write. Some are like 20. So I did that for some time. I spent some time in DC lobbying for healthcare and got involved in the local healthcare advocacy groups in Baltimore, because Baltimore was the main hub for the organization that I worked for. I trained all of the admissions people. I trained all of their business office managers in Medicare and Medicaid and how that money works. I did trainings on insurance products and how to properly verify insurance. I did a lot of public speaking and trade shows and advocacy for nursing homes and assisted livings, because nobody really thinks about nursing homes and assisted living as a sexy kind of career. They think of old people and dying, and we get a bad reputation where we do a lot of really great things, but people just don't know really what we do. They think people go to a nursing home to die and that's it, and it's a lot more than that. So through all of those talks and the advocacy work that I was doing, I was asked to be a part of the Lifespan Beacon board, which is an education network that's nationwide. And they give education to healthcare professionals and to just the general population that's interested in learning about healthcare advocacy and healthcare law. So I'm now on that board. I've served on that board for 3 years now. but none of that was really planned. And then I'm sure most of you have heard that there was a pandemic. Um, During the pandemic, I had gone back to school to get my nursing home administration license. I had always wanted to be a nursing home administrator, but it was never the right time for my company. My company really loved me in that regional role where I was traveling, and they let me get my license, but they didn't want to put me in a building because they wanted me to stay in my role. So during the pandemic, my company actually sold, and the company that bought us gave me a choice. They said that I could stay what I was doing, I could keep being a regional vice president, or I could achieve my goal and I could go be an administrator in a building. Um, Sometimes I debate my life choices, but like I said, never say no, just say yes. Any opportunity, just say yes, because the worst thing that can happen is you don't love it and then you can always change. But I said yes. I became a nursing home administrator, and I learned so much. So if you don't know or you didn't follow what was happening in healthcare during COVID, nurses quit, caregivers quit, everybody quit. Nobody wanted to work in healthcare. They forced all of us to get a COVID vaccine. They said you won't have a job if you don't get one, and that they being the federal government. Um, it was a really, really hard time to work in healthcare, but if everybody quit, the people that needed healthcare wouldn't have gotten healthcare. So I took that opportunity to make an example for my team and really show them, like, if you're in this, you're in it because you love people and you love helping people. So I went and I got my certified nursing assistant license. I got my caregiving license. And there was days that I worked on the floor and provided direct patient care to people during the night. And then I would change it into my business clothes and walk into my office, sleep for an hour, and then do my day job because there was nobody else. So it was really, really, really hard to do that. But it also really changed my perspective because I was always doing the fun things. I was admitting people, I was planning marketing events and running activities and teaching. And it's really humbling to provide direct patient care to somebody. It's a totally different experience than having fun with them and playing games. Like, people don't necessarily want somebody to give them a shower or to change their brief. Like, it's just very, very different kind of connection that you have with people. So that changed the way that I did my job as a healthcare administrator because I knew more what I was asking my caregiving staff to do. And I could be a better leader for them. And now I keep that license, even though I don't need it anymore. People have pretty much come back to work. I still, at least once a month, provide direct patient care because it's good to keep those skill sets, and it's a good way to build like morale with your team because they know that I'm not going to ask them to do something that I wouldn't do myself. Um, and I'm not the only person who did that. I'm dietary managers, housekeeping directors, social workers, several people just went and got their license because they really loved people and they wanted to help, and they saw that there was no caregivers and they saw that nurses were quitting. So we all just said, during the COVID waivers, we can get a license. We're going to go ahead and get that license. And that team of people I've since left, which that's a whole nother story. We'll get there. But that team of people and I are so close. We talk every single day. We have a massive group text, and there's about 20 of us that we were all in. We basically all lived together. We were a giant family during COVID. So it was really hard, but I don't regret it for a second. It was a great way for us to just serve those residents that live there and for us to bond as a work family. So um, all of that being said, during that time, nobody was going on vacation, right? Um, I hadn't been on a vacation. I hadn't taken a day off in literal years. And I have two kids who were very little during that time. They're 6 and 7 now, so they're still little. But I decided that when things started opening up, I wanted to go on a family vacation with my parents and my sister and a whole group of people. So we came to Isle of Palm, South Carolina, which is right outside of Charleston. It's pretty quiet. There's not a lot going on. It's beautiful. It's very relaxing. And we had gone there before COVID as a family every summer. So we had friends that we had made from going on vacation, and we were on a boat with one of our friends. And I asked him casually, hey, if I was going to work in healthcare in this area, where should I go? And he said, oh man, there's this new place. It's called Wellmore at Daniel Island. It's beautiful. It's really fancy. It's private pay. Everybody knows about it. That's where I would work. So I looked the place up on my phone on a boat in the middle of the Atlantic Ocean fishing, and the executive director job was posted. So I hit quick apply. I didn't look at my resume. I didn't edit anything. I didn't write a cover letter. But this is bad advice. You should always have a good cover letter. You should always look at your resume. I didn't do that because I didn't seriously think that they would consider me as an applicant. They hired me while I was still on vacation. They called me in for an interview while I was on vacation. They paid for me to move to Charleston and move my family to Charleston. They let me give a full 60-day notice to my previous employer so that I could leave on good terms and get them, a person to replace me. They paid for a house for me to live in until I could find a house to buy. I mean, this company did everything they could to get me down here in Charleston. So they were wonderful to me. This community was very different than what I had been doing before. My whole healthcare career, I'd worked in Medicare and Medicaid facilities, primarily people that didn't have a lot of money, didn't have a lot of family involvement. They were getting that state and federal funding to pay for their care. And those types of buildings are older, they're not always clean, and you do the best that you can with your team to make them a desirable place to live. The community that I work for here, it's all private pay. We have independent living, assisted living, memory care, and a nursing home, and then a long-term care nursing home, all on one campus. We have a home health agency here, a fancy dining room. We have a swimming pool. We have a movie theater. We have an arcade. We have a billiards room. We have a library. It is a giant campus. So if you're interested about where I work right now, you can look it up. It's well-more.com. There's pictures of the campus. It's beautiful. It's on a marsh. We're about 10 minutes from Isle of Palm, that beach that I was at when I was applying for the job. But it's a very, very different kind of place. And the residents that live here worked their entire lives so that they could retire in a place like this, so that everything is provided for them and catered to them. So it's very expensive to live here. And for me, it's a very different kind of job. Before, I was super hands-on and kind of into everything. And here, I'm the executive director of the campus, but I have another licensed nursing home administrator that works under me. He runs the nursing home, and I have a nurse that runs the assisted living and the memory care. And I have department heads to kind of run every department. So it's still a lot of responsibility, but it's more delegating than it is hands-on work at this community. But that's kind of how I got here. But by always saying yes to things that didn't always make sense to me. Not my plan at all. My plan was to write, and I write every single day, but not in the way that I thought I would. So I think that's it. You're still muted, Monica.
My mouse disappeared. Yay. I just Googled the place that you're working now. That looks like a luxury hotel. That's pretty sweet digs you've got.
One of my residents has a patent on a cure for cancer.
Wow.
Another resident, he started the main private school in Somerville, which is about 40 minutes away from here. He also was a founding member of the Library of Charleston and was a professor at the College of Charleston. The architect who designed Dulles Airport lives here with his wife. So there's really amazing, interesting people that live here.
Wow. Okay. I actually have a question before everybody else starts writing their, I have a questions in the window. Um, what skills did you find were the most transferable or what did you find yourself returning to again and again from what you learned at Shepherd?
Um, well, is Dr. Webb still there? Or is she gone?
She's gone. She's long gone.
Dr. Webb was our public speaking teacher, and she was very hard on us, very hard on us. But she got us outside of our comfort zones. So the public speaking I have used every day, staff meetings, lobbying in DC, dealing with challenging family members, dealing with challenging residents. That's something that happens every single day. So public speaking was definitely something that was transferable. Have to use it, have to know how to talk to large groups of people. Um, not so much now, but early on in my career, the web design and the graphic design classes that I took with Monica and Kevin, those I used often. So early on in my career, I was still doing some freelance work and doing some web design. So I used that a lot, and it helped me with what I was doing in my career, because even though I wasn't always building the websites by hand, I still had to edit content and make suggestions to the companies that we were working with. And even now, we still like, for our marketing, we still look at the search engine optimization and what are our keywords and how are we being looked at. And that's still something that I have to deal with on a regular basis. So that's all really important. Um, I don't know if you still teach this class or not, but Monica taught a class about like the fonts that you use. I don't remember what the class was called.
Oh, I taught it's advertising and imagery. It had all sorts of stuff in it, but that's where I would cover fonts. Yeah.
Do you still teach that?
Yes.
Oh, good. If you don't take that class, you have to take that class. I still use that in both my professional and personal life because it's everything. The size that you use, the font that you use, the actual word that you pick to be the word that you want as your keyword, all of that is really important. Especially in healthcare, because like I said, healthcare is not sexy. People don't think of old people as being super fun, so we have to make it fun. Um, so that's definitely something that really helped me.
Gotcha. Great. Jenna, you're up.
So I have two questions, but I'm not sure if one would be considered serious or not. So my
Any
first one
question
is,
is good.
well, wait, do you miss being more hands-on with everything in your daily role? And then my other little question that is like a quick address. So if they gave you like relocation services and stuff and like treated you well, have they also like given you a nice retirement plan then?
So there's not like a pension or something like that. It's really, you're hard pressed to find a place that will do that. But they do take good care of their employees. So they offer a 401k plan, which if you don't know what that is, you should definitely look it up. I'll give you the Reader's Digest version. You can take a 401k plan to any company that you work with. If you leave a company, you can roll it into the next company's 401k. That's a choice. Or you can keep them out there in the world as separate 401k plans. I recommend combining them, but you don't have to. And the 401k plan basically just makes you money and you don't even have to think about it. They take money out of your check before you even see it. It's not taxed and it goes into your paycheck. Some companies, that's all they do. This company matches dollar for dollar what I put into my 401k. So if $500 comes out of my paycheck and goes into my 401k, the company then puts $500 in, and every 2 weeks I'm making $1,000 in my 401k. That's an example. But not a lot of companies do 401k matching either. So even if they don't, having a 401k is a smart plan because you can use that if you have an emergency. If you need to buy a house for the first time, or if you're struggling and you're going to foreclose on your house, or if you have a problem with your car and insurance doesn't cover it, but you need to pay off that car loan, you can borrow from your 401k without a penalty. You just have to pay the taxes on it. They don't let you take the full amount out, but you can still borrow from your 401k. So that is my unofficial financial planner. If you have the opportunity to get a 401k, you should definitely do it. But that's what they do for a retirement plan at this company. They do the matching 401k, which most people do not do. And then your first question, I absolutely miss doing direct patient care. That's why I make a point to come here on an evening or come here on a weekend and still do it. It's just really important, and it helps you connect with the people who live here. I try to like do an activity with them once a month. I do like a speaking series quarterly with the residents and kind of talk to them about things that I've done. This company actually sent me to Africa in September. They partner with a faith-based organization called Untold Plus, and they treat patients who have AIDS and HIV diagnosis in Africa, which it's very different than it is here in the States. It's very much taboo. They believe that you're a dead person if you get that diagnosis, when really you can continue living a very normal life. You can still get married, have children. Your children can be HIV and AIDS negative, and they don't know that. So my company sends a group of about 20 people twice a year to go and work directly for Untold Plus, and it's a company sponsored trip. We have to fundraise our travel costs. But I got to do that. And so that was one of my speaking sessions with my residents. They got to see the pictures from my Africa trip and hear what I did in Africa. And at the end, we got to go on a safari in the Serengeti. So like all of these things I've been able to do basically because I took a chance and said yes.
Cassidy, how about you next, please?
Hello. I really liked hearing that you were part of Tri Sigma because I'm also in it, and a couple other girls, several other girls in the class are. So I was wondering, how did your time in a sorority help you in your future career? Because I'd love to hear how those skills were transferred.
Okay, so everything that you do for philanthropy is going to carry over into your life if you choose to have it carry over into your life. That's still something that is really big for me. I'm still trying to find ways to give back to the community. So that definitely is important. And the relationships that you build in a sorority within your own and then the others through Panhellenic, those relationships last. I'm still friends with the people who were in my sorority, and we can still reach out to each other if we need something. I'd say that's true of my mass comm class too, even though they were like boys and girls and they weren't all in the sorority. I kind of had my sorority group of friends that I could always rely on, but then I had my comm people that I could always rely on. My like best friend in the whole world, Kyle Hendrickson, Monica,
Oh, Kyle.
we still plan to see each other at least 3 times a year, and he lives in California and makes movies, so that's really cool, and also works at Apple. And then I'm all the way over here in South Carolina, but we still try to make time for each other. So the relationships that you build in your groups in college are really important. That group foundation is going to carry you through. You're going to have friends throughout your whole life that you can call on and ask for help or ask for advice or write you a recommendation letter if you're thinking about doing a different job. I've not in a while, but I did a road trip to Texas a couple of years ago, and there's a Tri Sigma sorority out in Texas, and I like put out there on one of the Sigma message boards like, hey, I'm traveling and I need a recommendation for where to stay. And a bunch of girls were like, oh, we have an apartment, you can stay with us. So just know that it's like any relationship. What you put into it, you're going to get back. So if you make those close connections and you put the effort into those relationships, you're going to get them back.
Okay, Audrey, it looks like you're on deck, please.
Hi. I was curious about the grant writing that you mentioned. And I guess I just wanted to hear a little bit about what kinds of grants you've written and maybe what you think is like the most important like sort of skill set to have to write a good grant or something along that lines.
The most important skill set is patience, because they are going to deny your grant no less than 10 times. And they're going to tell you to rewrite it. And you've like poured your heart and soul into it. And they are going to keep telling you no. But eventually you're going to get to that yes. So being patient and being persistent are probably the best ways to get through the grant writing process. I think the two grants that are like most important to me, the first one I did, I got told no 13 times. And it was for Medicare funding that is when a nursing home does something wrong. They are issued a fine if it's something severely wrong. And that money goes into an account that they call a CMP, or a civil monetary penalty. And the money available through the CMP is available to any nursing home in the entire United States if you write the appropriate grant. And all of their grant writing is done through an online portal. Even back then, 13 years ago, it was done online. What I wanted was to open a certified dementia unit in a nursing home that had a pre-existing secure area, but they weren't certified as a memory care unit. And I wanted the grant money to pay for this renovation to change the way that the security was so that would be safer. I wanted there to be these wall murals through this unit that could engage the residents in a meaningful activity. I wanted some technology for them. I wanted some tablets and some different things. And they had like workstations that you could create for the residents. So a lot of people with dementia, they live in a different time. So some of them think that they're 30, some of them know that they're 80, some of them think that they're a baby and they're asking for their mom. So you can set up different stations that are going to be meaningful for people at different phases in their dementia. So there was a nursery that we wanted to do. We had several people, it was Baltimore City, so we had several people that were truck drivers, and we wanted like a virtual reality area where they could have a steering wheel on the wall, but it could look like they were driving a truck, and then have the headset that they could listen to music on, and they could like turn the dial on the radio. So we wanted things like that where they could meaningfully engage. But like I said, they turned me down multiple times, and it wasn't because what I was asking for was unrealistic. It was the way that technically they wanted me to fill out the form and the way that technically they wanted me to do the writing. So every time I would get close, they would then say, okay, well, this section is approved, but you need to go back to section 5B and you need to change this. And then they would say, here's the parameters of the grant. So we can give you this, but you have to change the wording. So that first one was really tough. But at the end of the day, after 18 months of going back and forth on this particular grant, we did get the grant. They granted us $23,000, and we were able to do everything we wanted in the unit. And we got those 60 beds certified in that facility. So it's now a certified memory care unit many years later. The second one that was important for me, it was a very different kind of grant. It was all on paper. It was a bigger one. It was about 500 pages, and it required me to spend some time in DC. But in Maryland at that time that I was writing the grant, they had canceled the funding for people who had dual diagnosis, mental health, and substance abuse issues. And those people used to be able to go to a mental health facility, and they closed all but 2 in the state of Maryland. So what Maryland saw was more people that were homeless and more people on the street, because there was they had mental health issues and substance abuse issues and no place to go and no family to help them and no place to live. So that was a problem. And then a large number of those people were actually veterans that were denied VA assistance because of the dual diagnosis. So myself and then one of my friends that I made through doing public speaking in healthcare, she was a healthcare lawyer. She and I were writing this grant together. So finding the time for us to meet at the same time was a challenge, but we ultimately wrote this grant, we were able to write a grant that provided access to nursing homes in Baltimore City for people who had a dual diagnosis. And the way that they were able to get into nursing homes was if they had a dual diagnosis and they were willing to accept an AA and an NA sponsor, and they were willing to attend an AA and an NA meeting within the nursing home, they could discharge from the hospital to select nursing homes so that they could get the help that they needed, and they would be able to be covered with medical assistance or Medicaid during their stay in the nursing home for up to 120 days. So before, the hospital would tell them, oh, there's no place for you to go, you're discharged, you're back in the street. And because of the grant, they were able to get 120 days in a place that was going to monitor what they needed, monitor their medications, and keep them safe. So those are like my two favorite ones that I did, but that one was all on paper. So anytime there was an edit, you had to go back and edit all of the forms and rewrite everything. So you just got to be patient.
Wow. So Liz, you have a question now, please.
With advocacy, I was wondering sort of like what goes like into that, like what encompasses that, like what exactly do you do with that?
So, I mean, that depends on what you're looking at. For me, we were just talking about that grant. At that time, I was an advocate for people who had mental health, substance abuse issues, and I was advocating on their behalf that they should have funding and appropriate health care. And it solved a common problem. It helped with the homelessness problem in the city. It helped with the readmission rate. The hospitals get fined if they have people in and out. So it helped cut costs, but also helped people get the care that they needed. So that's something that I've helped with. Now, I primarily advocate for families that are going through a transition. So I think I mentioned that I have all these dementia certifications and that I train, but what people don't realize unless they're dealing with it directly is that you're losing your loved one twice when they have a dementia diagnosis. You're losing the person that you know because they don't know who you are anymore and they don't think of themselves as old. Sometimes they do. Dementia is very strange, but they're not the person that you knew. So you have to grieve the loss of that person as they transition through the different phases of dementia. And then eventually people die from dementia. So then they're going through a second grieving process. And a lot of people have a hard time navigating that. So I currently work with the Alzheimer's Association, and I work with the families that are going through that transition of I'm grieving my loved one now, and I'm going to have to grieve them a second time. And so I'm an advocate for them to make sure that they're getting the right support that they need. And I help them navigate whether hospice is appropriate, or if they need to be in an Alzheimer's support group, or if they should be in a support group within the community that their loved one is at. Because like a place where I work, we have our own support group, and other places have that too, but some places don't offer it because they don't have the funding or they don't have the staff to staff it. So they'll send them to a church or some other place to get that support. So my role in advocacy for them is to find them the right group for them and make sure that they're getting the right support that they need. Does that answer your question?
Yes, it does. Thank you.
Anyone else? Well, this is certainly, you're the first healthcare professional that we've had. We have had people that have ended up being lawyers and things like that, which you wouldn't expect to be the normal calm trajectory. But clearly, whatever you're doing the right thing because you've got a really
Career and you're doing what you want to.
Yeah, again, never in a million years thought I was gonna be doing what I'm doing, but every strange opportunity, the random guy in Buffalo Wild Wings that asked me to do a volunteer program, the friend on a boat that said, oh, I'd work at this place, and I just randomly hit apply and here I am, but never thought I would be an advocate for mental health and substance abuse, but it was a need in the community. So just know that whatever you're doing, say yes to every opportunity. You can't go wrong, because if you hate it, you can always change it. You can always say no. And for my sorority sisters that are out there, just know that that community, that family that you're building, that is going to stay with you. And even if you are not in a sorority and you have a different kind of family, if you have your calm family, stick to them, because you're going to have that network forever. I still talk to so many of the people that I graduated with, and stick with Monica. And is Kevin still there?
Oh, yeah.
Stick with Monica and Kevin. Like, I don't talk to Kevin as often as I probably should, but I follow Monica on Facebook, and I have for the last 14 years. And so
I know, it's so
yeah,
weird.
now I'm talking about my career, but the people that you meet and the professors that you have, they're going to be people that you remember for your whole life. So that's my advice.
For good or for bad, I guess. Happily, I have nothing but good memories. Well,
thanks, everybody.
um, this has been your first chat. So now you've gotten through it, all you newbies, and you Capstone Project folks, you're all pros at this now. But thanks so much, Juliana. It was just lovely to see you. And actually, after I send the students off, I'd love to just hear a little bit more about some of your peers that you've kept in contact with.
Oh, sure.
All right. So all you students can go. Thanks.
Thank you. Bye.